Welcome back to ACT Webinars for Healthcare Professionals. I'm Robin Geiger, the Chief Nursing Officer for Ingenovis Health, and we have a really good webinar in store for you today. I'm really excited to have one of my colleagues with me today. Jen Cook is the VP of Human Resources for Ingenovis Health, and we want to talk about, some really serious topics, but we want to make sure that we're doing this in a way that everyone can relate. This month is National Suicide Awareness Month, and there's so much stigma around mental health programs in general and acknowledging need for self-care and well-being. So I'm excited to bring her in to talk about all of these different topics, especially employee assistance programs. Jen is an accomplished leader with over 16 years of experience in the staffing industry. She is the Vice President, like I said, of Human Resources at Ingenovis Health, and she delivers benefit strategies that promote total employee wellness, particularly for healthcare professionals facing unique challenges. Her strategic mindset and commitment to fostering employee engagement have earned her a reputation as a catalyst for positive change. And I'm really excited to welcome you. Hi, Jen.
Hello, thank you so much, Robin. Thank you so much for the great introduction. I'm really excited to be here with everyone today and talk about employee assistance programs. I'm here to talk about some EAP insights and how do we separate kind of fact from fiction when it comes to employee assistance programs. I think that employee assistance programs are kind of one of those benefits that maybe we've all been guilty of seeing an email come across from your organization or your human resources department, and you saw something about an employee assistance program, and you maybe deleted it because maybe you didn't know what an employee assistance program was or how it may support you as an employee. So my goal today is to help you walk away with some more insights surrounding why this is such a valuable benefit for you and oftentimes members of your household as well. I really appreciate you being here. I know everyone's very busy and has a lot going on, and you chose to be here with me today, but also making an investment in yourself and your well-being by being here. So thank you all for joining. All right, so what we're going to talk about today is really, what is an employee assistance program? Why do employers offer employee assistance programs? The big takeaway here is what's in it for you, and then really kind of diving through some myths surrounding employee assistance programs and which of those myths are fact and which are fiction, and then how EAPs work and just some takeaways that you can hopefully take away from this presentation with you and learn more about an employee assistance program that may be available to you through your employer. But we're going to kick it off with a polling question. So you will see a poll come up that you can participate in. We greatly appreciate your feedback here. There's no right or wrong answer, but how much do you know about employee assistance programs? So no knowledge, very basic knowledge, maybe you have some moderate knowledge, maybe you have advanced knowledge of employee assistance programs, but just curious to see how familiar our audience is with employee assistance programs.
We'll allow a few minutes for them to answer. They're usually kind of shy.
All right.
Okay. There we go.
No right or wrong answer, remember. All right. I'm going to be honest with you. This is not surprising. What we found and why this is a really valuable topic is that most people don't have a lot of knowledge surrounding employee assistance programs, and that's okay. We're going to hopefully take care of some of that today. So, all right. What is an EAP? And a lot of times we inside of HR forget that not everybody knows that EAP is an abbreviation for Employee Assistance Program. And what it is, very generally, is an employer-paid workplace benefit program. And there's different kinds of EAPs. There's an internal program, an external program. We'll talk a little bit about embedded programs. All with different nuances. But the goal of EAPs is that they're designed to help employees manage those issues that we deal with, either in our personal lives or in our work lives, or potentially in both. An important call out is that not all EAPs are the same. And so we're going to talk about some of the differences throughout this program. But there's something called an embedded EAP where it would require you to be enrolled in maybe your company's medical plan to be able to access the resources behind the employee assistance program. So there's things that differentiate EAPs like that. Some EAPs extend coverage out to members of your household, not just you as an employee. Some offer face-to-face or telephonic visits. And even within those programs that offer that benefit, the number of face-to-face visits or telephonic visits can vary from employer to employer. And then my favorite is that there's lots of different state requirements for employee assistance programs. So depending on the state that you live in, depending on the state where your employer is located, you may have additional add-ons to your employee assistance program that has enhanced or kind of extended services for things like substance abuse counseling or rehabilitation. So, there's so many different variables. Not every EAP is the same. And we'll talk about things that you can go back and research within your EAP program. Whether that be through contacting HR, going to like an intranet site maybe, or speaking with your supervisor, but things that'll be important to know. So let's talk about two of the more common employee assistance programs that are in existence today. So the first being an internal EAP. And this simply means that your company employs the providers that offer these employee assistance services to you. So you may have an organization where you have your own psychiatrist, psychologist, or licensed counselors and therapists, and those are the ones that you go to when you need EAP assistance. This has become much less common. We'll talk about why, but some advantages to an internal EAP are that providers already have that existing knowledge of your company's culture or some of the things that are going on in the environment of your company. And so they can better relate to some of the stressors that you may be dealing with or some of the conflicts or scenarios that you're dealing with. Another advantage is that when needed or when appropriate, the therapist may be able to have more power to request certain work accommodations for you. They are faster to get in touch with and oftentimes have more flexibility because they're employees of the company where you work. And then because they are employed at the company where you work, you don't need a referral. You simply need to be an employee at the company to be able to access their resources. There are some challenges that come along with having internal employee assistance programs. So one is that providers may only choose to work with the employee versus members of the household. Another one, and I think this is a really important one, is that employees tend to be more hesitant to reach out to or connect to an internal employee who is part of the employee assistance program, right? Do I want to call my coworker and talk to them about the issues I'm having in my marriage, right? So, just the comfortability level is not usually the same. Another challenge is that employees can't choose their therapist. So employers may not have a wide variety of healthcare professionals to support various needs. And so it may be difficult to find a therapist or find a licensed counselor who is specialized in the area where you're needing support. And then from an employer perspective, internal EAPs are really difficult to scale. So if you go through, either rapid growth or maybe a larger, event reduction, or maybe grief counseling is needed, because you're employing these professionals, you'd very quickly have to hire, right, these professionals to scale to support your business needs. So that's an internal employee assistance program. Because of the challenges I just laid out, these are becoming much less common. Chances are this is not what's offered to you through your employer, but they exist, so they're important to know about. More commonly, we see external employee assistance programs. So this is where your company is using a provider who's not affiliated with your organization, or it might be a third-party company that your organization is partnered with to offer these services. So some advantages here are that employees have more confidence in the confidentiality. So I'm going to myth buster number one here is when you're dealing with an external EAP, which most organizations are, it is 100% confidential. In that, if an employer wants to know any sort of utilization information with their employee assistance program, they're simply given numbers, and usually it would be like per quarter. So 18 of your employees engaged with our EAP in Q2, or 6% of your population engaged with us over the course of 2023, for example, right? That's all the information that you're getting. But you're dealing again with somebody who's outside of your company, who does not know you, and therefore these providers are going to be much more unbiased. They're an outside source. They have no ties to the company. So that's also an advantage. The other advantage is that EAP programs, they employ a wide variety of licensed therapists and professionals who specialize in a variety of areas. And so external EAPs give employees a much better, I guess, group or pooling of providers to choose from, so you can find one that best suits your needs. And then household members can take advantage of external EAPs as well. And this is important because, as we know, as employees with loved ones and family members, we tend to be better when our loved ones are okay, right? And so to be able to offer this resource and extend it out to family members, it helps all of us. Some challenges to external EAPs is that not all providers accept EAP plans. And so your external EAP or your plan that your company offers typically will provide a set number of visits that are covered outside of health insurance. You don't need to be enrolled in health insurance or any other insurance for that matter, but they'll provide you with a set number of visits that are covered by your EAP plan. Not all providers will accept those, will accept the EAP plan. That's a challenge. Employees may need to find their own provider, and we're going to talk about that a little bit later on in a couple of slides, but you may need to, right, geographically, there may be some limitations to help find a provider. And so the employee may need to do a little bit of work along with the EAP program to identify a good provider. Many providers don't have immediate openings. So we know that the need for healthcare and mental, emotional, support is greater than ever right now. And there's more demand than there is supply for these licensed providers. And so sometimes you may not be able to get an appointment right away. And then the other sort of challenge for employers is that the employers themselves don't get to vet the providers that are available to the employees. So it's not like an internal program where we can interview, and really get to know these providers that we're putting out for our employees. We're relying on the companies that we partner with to vet these providers to ensure that our employees have access to high quality, high care professionals out there to support them. So those are the differences between an internal and an external EAP. And I mentioned earlier an embedded EAP. And so if your employer requires you to be enrolled in your company's medical plan, in order to take advantage of EAP services. That would be an example of an embedded EAP plan. However, a lot of the advantages and challenges listed here are the same for those embedded plans. Just know that the additional challenge is that if you're not enrolled in the medical plan, for example, you don't get to access these services. It's becoming less and less common, quite frankly. Because I want to get into why employers offer employee assistance programs. And we're going to go on a little history lesson here, if you don't mind for a second. But employee assistance programs really started in the 1930s, not known by the name of employee assistance programs, but there were some companies in the 1930s who were dealing with some productivity loss, to be quite frank. And what they found was that they had several white-collar workers who were dealing with alcoholism. And the employers themselves were not qualified to address, alcoholism. They weren't licensed, substance abuse counselors. And so they brought in some external counselors who were specializing in alcoholism in the 1930s. And they helped employees have access to find different coping mechanisms. And when they did that, they saw that not only did the employees' morale increase, but the absenteeism went down, and therefore the loss in productivity went down as well. And so they deemed this to be very successful for both the employee and the employer. And that really is what kickstarted employee assistance programs that didn't get their name until 1962, was when we first saw an insurance company roll out the first official employee assistance program. And at that time, they decided, to address more than alcoholism or any kind of substance abuse. So they did start to kind of enhance the services to include, employees' families, emotional support, as well as, family relationship and marital support. In the 1970s and 80s, the popularity really rose with employee assistance programs. And a lot of this was due to federal funding being cut for mental health programs. And you started to see the market become really saturated with companies offering employee assistance programs. And you also saw companies sort of delivering employee assistance programs or newly offering them to their population as a retention and an attraction tool, because back then it was like, if you want to be able to attract and retain the best talent, you have to have the latest and greatest, and employee assistance programs are it, right? And so they became really popular during that time. 23 years ago yesterday kind of became another important date for employee assistance programs. So 9/11 forged a new, opportunity for employee assistance programs to expand their services even more. And so this was really one of the first times you saw employee assistance programs expand their mental health services. You also saw them start to come in and think about more than just grief counseling, but think about, the long-term effects of grief, post-traumatic stress disorder, right? They really started to expand based on this sort of one historical event. And then we had COVID. So 2020 to present, you started seeing employee assistance programs expand out again, and with more focus on helping employees find childcare, focusing on providing resources and tools surrounding resiliency, burnout prevention, addressing isolation, which so many of us started to deal with in 2020 as we left our workforce, or maybe what used to be our regular, workforce, that changed. The grocery store changed, right? The ways in which we interacted with our family members and friends changed. And so EAPs recognized that and started to put out more resources and more tools for employees to understand how they can cope with and identify the feelings of isolation. As we return back to work, or whether that be in a hybrid setting or a fully remote setting, or a back in office setting, we kind of had to relearn that work-life integration. And for those people who work hybrid or work remote, establishing those boundaries between your work life and your personal life, they got really blurry. And so EAPs realized that they had an opportunity to focus on resources to help us as employees create those boundaries and have some separation between our work life and our personal life. And then the other thing is the technology of it. To be quite honest, you know, an EAP used to be a phone number. And, you know, 20 years ago, your HR department might have to initiate some sort of support from an employee assistance program. Today, these tools are often at your fingertips through an app, a website, a phone number, all three, right? So it's really about convenience. It's about recognizing that we are very busy and there is no certain time of day that we have, you know, carved out to focus on researching something or taking care of a need that we have. So it's 24/7 access, right? 24/7 assistance at a time that works for you, conveniently accessible. And the other thing I will say is that employers offer EAPs because we know that in order for an employee to bring their best and an authentic self to work every day, things have to be going okay in their personal life, right? And so if employers can offer a service to their employees to help with things like finding childcare or needing some legal guidance or resources for something else that's going on in their personal life, you know, if we can bring an employee to work who is, I don't want to say carefree, right? But who's able to find access to resources and tools to help address the things that are causing them stress, we know that that employee is going to come in and be a happier employee, right? And enjoy work and be more engaged and be part of that positive team morale and culture. So that's really, in general, why employers offer them. The other thing I will say is that post-COVID, there's been so much research on the increase in mental health needs and mental health issues. And the American Psychological Association did a study in 2023 that showed that 3 out of 5 adults who were surveyed stated that they have mental health or they have stress that they cope with on a daily basis, but they don't want to talk to anybody that they know. They don't want to talk to their support system about it because they don't want to add to their support system stress or have them worry about them. And so we know that. And so it's important for employers to give employees an outlet to go to outside of family and friends. You don't want to tell your employer everything that's going on in your life, right? These are private, you know, personal matters. That's why they're offered. Robin, are there any questions? I just want to pause and see if there's any questions that have come up that I can help answer.
Yes, you've had a couple. You have quite a few questions. So I'm not sure if you want to just tackle one or two right now, whatever your pace, whatever you'd like to do. Would you like just maybe to do two, or would you like all?
Yeah, give me two.
I think you have 7 so far. Okay. The first one we'll do, if I'm a clinician that works during the day, would an EAP be available to me outside of work hours?
Yes, it should be.
That's a good question.
I can't, that's a great question because really and truly EAPs are designed exactly for that. 24/7 access, because we all work different shifts. We all have different things going on in our personal lives. The answer is yes. You should be able to access it 24 hours a day, 7 days a week at a time that works for you. Great question.
And yes, and your next question, Jen, is what are the most effective strategies for promoting the utilization of employee assistance programs among employees? Some may
Yeah,
fear the fallout from personal issues.
yeah. I think it's opportunities like this, and as an employer or as an employee, understanding what's available to me through my employee assistance program, um, educating yourself on what an employee assistance program is by attending things like this webinar. And so I think the biggest thing is, and we'll talk about it, the US is the most saturated EAP country in the world.
Right.
Yet employee assistance program usage is much lower than many other countries. So we have more programs out there, but we have fewer people using them. And we'll talk about, why is there a stigma attached to it? What are some of those myths that I think, and over my years of experience, I think lead to people being really apprehensive about utilizing an employee assistance program? Those are great questions. Hopefully we can kind of might be able to answer some of the other questions as we continue forward. So, what's in it for you? I'm going to be really honest. About 15 years ago, most people thought of an EAP as, we had a colleague who passed away suddenly, and now HR has brought in these people for us to talk to if we want to share our grief and share stories and work through it. And so most people think EAPs are crisis support. It's, something tragic has happened and they're just there for me for my crisis support. And while that is true, we're going to have that fly away, because what's in it for you is more than you could possibly imagine. Employee assistance programs today not only are available to support your mental and emotional health. We know that there's licensed counselors on the end of a phone line or via live chat features, right? But they've been extended to members of your households. Employee assistance programs provide resources on physical health and nutrition. And I don't mean, there's a recipe section, right? I mean, it will get very specific if you have dietary restrictions, allergies, right? And you want to understand, how you might find out if you have, an allergy to gluten or a gluten sensitivity. Your EAP can kind of help walk you through the first steps to determine whether or not it's worthy of, making that appointment and going to a provider. Substance and alcohol abuse. Employee assistance programs are going to work with you to, one, just talk to you. If it's a concern that you have for yourself or a member of your household, that maybe, there's a coping mechanism that's turned into a habit, and this habit is maybe turned into something that's impacted other areas of your life or your loved one's life. They're going to be able to talk to you through that, and then also be able to make referrals to, outpatient or inpatient help. Legal and financial guidance. I think this is one that most people, don't realize are embedded within employee assistance programs. But how could we take care of employees if we didn't think about the financial stressors and strains that they have in their personal lives, as well as some of the legal needs that we have? Think about estate planning, maybe just searching for an attorney. And the financial guidance can really range from basic budgeting all the way to, I have a senior in high school. And so, we're thinking about college and how do we pay for college? You can go out and, research all of the different options on student loans and what that looks like, just to help prepare yourself for those conversations with universities. Relationship support. And this is huge, because whether it's in our work life or our personal life, we have relationships that exist in both, right? And so there's a lot of, conflict resolution, and you can talk to somebody about it, or you can go out and look at some self-help, self-service kind of tools, articles, videos, They have questionnaires out there that can help you understand what type of communicator are you, right? I will tell you, post-COVID, this is one that I've heard a lot from employees on, and that's using an EAP to locate childcare or elder care. So aging parents, and trying to navigate. I don't know about you all, but I personally have been touched by, and I've got a lot of people in my life who have been touched by getting to a decision where you need to locate a facility for a parent or an in-law, right, or a loved one as they're aging. And that can be very overwhelming in itself. But EAPs have a lot of resources to not only help you locate, but really understand the preparation that needs to happen sort of financially, or things to take into consideration before making that move. And then my personal favorite, because this is something that didn't exist 15 or 20 years ago in employee assistance programs, is that they finally recognized that in order to take care of an employee, well, we all are curious about our careers and how we can be better employees and better leaders, right? And so you'll find things like how to manage your time, right? Prioritization, time management, but also how to build connections with your team or with your employees. Post-COVID, there's a lot out there on how to be effective in a remote environment with your team, right? So what's in it for you is really a variety of resources to speak to many of the things that we face on a daily basis or a weekly basis, and things that we know will eventually need to address in our lives. And this is a great starting point. It's a great starting point to empower you and educate you on what a next step would be. So not just crisis support anymore. The other thing that EAPs have done a really great job of is finally understanding that, you know what, we don't have time to reach out necessarily they don't have orthodontist hours, and no offense to any orthodontists who may be on today's webinar, but as a parent of 2 teenagers where we've gone to the orthodontist, it's really not for working parents. It's 9 to 3 or 9 to 4, right? EAPs recognize that, well, one of the reasons why you have access to them is because you have a job, because you are employed. And so nowadays it's one resource. So there's a website, and on there you can live chat, you can, locate the phone number, and you have really a lot of self-service articles in there, 24/7 access, not just to, anyone, but licensed professionals who are highly trained and highly skilled in a variety of areas. They offer that confidentiality. And again, it's really about convenience for employees. When I think about employee assistance programs for professionals in healthcare, here's what I think about, and I hope you all can understand why. I didn't want to say relate, right? But the elephant in the room is that as professionals in the healthcare industry, there's additional stressors and strains that you are exposed to by nature of your job. And many professionals can identify with most of these, but I really, at the heart of myself, I really think about our healthcare professionals out there working. So, just the high pressure environments that you're often working in, you have this consistent exposure to sort of these chronic high stress levels. Being, in a situation where you're experiencing a patient death, or you are experiencing a really difficult conversation with a patient and family members, some of these traumatic events that you're exposed to by nature of your job. Man, oh man, the work-life balance challenge, working really long shifts. Oftentimes now I know my friends who work out in healthcare, they used to be on call and they almost never thought they would get called in. They always get called in when they're on call now, and it's really, really difficult to feel like you're fully present at home and you're fully present at work when you are working so much. And so it's not lost on me that our healthcare professionals have an added element of, difficulty in maintaining a work-life balance. And because of that, it can cause family and relationship strain, right? It's difficult for working parents to feel like they really have that time to connect with their kids. And if you have teenagers, it wouldn't matter if you were around them 24/7. It feels difficult to connect. But as you're out there taking care of others, you know that you're sacrificing sometimes taking care of the ones that you love the most behind you. These are the kinds of things that when you call into an employee assistance program, or you go onto their website, or you live chat with somebody, they're ready to accept this type of conversation. They're ready to help you explore the resources on their site or within their, realm of resources to address these challenges. Because of the high stress levels, right? Because of the, the long hours, the many shifts, the feeling torn between, am I available at work? Am I available at home enough? Am I enough? It does increase the chance of, using substances as a coping mechanism. And so there's risks associated with it. And, EAPs are really designed to meet you where you are in this journey. If you're being proactive because you know that maybe there's a predisposition for you, to be somebody who would be more of, addicted type personality, you can be proactive and engage with somebody early. They can meet you in the middle of it, or they can meet you in a place that helps you find the right type of treatment for you. The ethical and moral dilemmas are something I commend all of you healthcare professionals for so much, because I know that day in and day out, you can go in and you can be faced with, having to honor a patient's wishes that go against your own belief system. And that in itself can have sort of, longer term effects than we even realize in the moment. And so being able to turn to an employee assistance program in times where a decision that we've had to make that was right professionally, but morally or ethically wrong for us personally, there's somebody there to talk to about that. Workplace violence, we know that, unfortunately, physical violence, verbal abuse, sexual abuse for our healthcare professionals has increased. And, this is something that while in the moment it can happen very quickly, afterwards, those signs of fearfulness to go back to your job, to return to it, to go to see your next patient, right? Or the fearfulness to see this patient again, it does exist. It continues to take a toll on you. And I'll even say, I've heard from a lot of, home healthcare workers, the belief system that, are you old enough to be caring for me, right? They may have a race preference. They may have a gender preference. So we're still, we're seeing racism, ageism, sexism on somebody thinking, they're questioning whether or not you're the right person to care for them. It can make you wonder why you're showing up to do what you do every day and as though you're not valued. And my earliest days right out of college, I was a social worker for adults with mental illnesses. And I can tell you that that was a job that made me feel as though I was never going to feel as though I was successful or I had completed or accomplished something. And that's a feeling that I think, really can lead to professional burnout. And so for all of these things that our, professionals who work in healthcare experience, an employee assistance program is especially important for you to take advantage of. In the big things and the small things that occur, but it allows you to be proactive, reach for the help, and get the help that you need when you need it, and also for members of your family as well. I think by now, I know this group is shy, but I also see they're doing a lot of clapping and hearting, so that's good. Thank you for that. It continues to encourage me. So let's wipe out some of the myths. Let's talk about what's true and what's not true, because as I said, we have a huge market of employee assistance programs in the US. Almost, I think more than 80% of employers offer them, but something I'm embarrassed to say, somewhere around 11% of employees actually utilize employee assistance programs. All right, so fact or fiction, only for crisis or grief support. There was that belief, 20 years ago that really EAPs were only if, I suddenly lost a loved one, or, I was really experiencing, some sort of mental breakdown. It's fiction. We know now, we went through all the different services and the different, areas of life that EAPs cover. So that's fiction. The other thing that I think is misconception is that if you call a phone number to speak to somebody, you're just getting somebody from a call center who's not licensed or equipped to be able to handle the issues that you're calling in with. EAPs, they employ licensed professionals and licensed counselors. My employer is told, this is the biggest one, most people never want to reach out to an employee assistance program because they feel like there is a stigma attached to needing help. And if my employer knows that I am struggling either in my professional life or in my personal life or both, right, there's a target on my back. I can tell you, employers are not told who is reaching out to the employee assistance program. That is fiction. Your employer is not told. EAP plan coverage may vary. It's an important disclaimer, right? Because the employee assistance program that Ingenovis Health offers may look different than the employee assistance program available to you. It's important to understand what's available to you so you can take advantage of all of the services because they are free. All right, so increases health insurance costs. It's interesting, but employee assistance programs, when used effectively, when marketed effectively, when you have employees adopting the plan effectively, they actually do the opposite. Employee assistance programs decrease health insurance costs. Then we know that if we're reaching out to them for help with things that are causing us stress, then hopefully we're getting the answers that we need, or we're getting the help that we need, right, to work through and resolve those things that are causing us stress. If we don't, and the stress continues to build up, those chronic, conditions that are associated with long-term exposure to stress are eventually going to hike up health insurance costs, right? And remember, if your employee assistance program provides you, 3, 5, 10, visits per year, Ingenovis is per year, per issue, right? So there's a number of visits per issue per year, per member of your household. Those are free. They have nothing to do with your health insurance costs, and they are free to you, and everyone likes free things. So use those. When you know what those benefits are from your EAP, use them. It is a fact that EAPs are an investment in self-care, and we'll talk a little bit about that in a couple of slides. And then employers offer EAPs to check a box. It is not 1970 or 1980 anymore. Employers are offering employee assistance programs because they want to make sure that employees are being taken care of, that employees who may live in underserved areas where they lack access or lack the financial resources, they lack the ability to have transportation to resources that could help them, right? Employers want to make sure all of their employees have access to resources and tools that can help in areas of relationship, career development, finances, legal, mental and emotional health, physical, nutrition. It's not just to check a box. We want our employees to be well. And however employers can promote the program, right? That's the key. Promote and inform people of the program is really going to be a reflection on how many people utilize it, adopt it. And it's not to check a box. I can promise you that. Not here at Ingenovis. It's not to check a box. How does it work? I think this is important, and this can vary. So I am going to say the disclaimer first. EAP plans differ. Check with your employer, or check your EAP plan guidelines to understand your plan specifics. But really the first thing is that if your employer has an intranet site or a benefits guide, something that you can access without having to ask for, you can locate your EAP information there. If you can't locate it, it's okay to ask HR. They don't put a check mark next to you or anything and say, oh, they asked for EAP information. Nope. In fact, if you have to ask, it's probably a good indicator to HR that they need to do a better job of putting it out there where it's self-service, right? Ask if there's any sort of unique login information needed or a specific code that would be needed to get in that identifies you as an employee of that company. Get the phone number so that you have access to the telephonic support, and share that phone number with members of your household as well. And then search the website. You know, websites have so many self-help resources that you can access at any time on a variety of topics. Utilize, remember that phone number, it's 24/7 availability, it's confidential guidance, can also be used in crisis times. So we talk about suicide prevention or suicide awareness month. You know, that phone number can be used for crisis situations. It can also be used for you to call and say, I'm having a rough day. You know, I gave this presentation, I felt like it didn't go well, and I just need to talk through it with somebody, right? They're there for you. The third thing, this is the one that is usually misunderstood. If you want to continue to engage with a licensed therapist beyond the number of visits that your EAP, that your employer has allotted in your EAP, you may have to do some of the legwork in partnership with the EAP to identify a provider that is right for you. You may have to divulge things like your zip code or the zip code in which you would like your provider to be in. You may also have to specify if you have a preference of a male or a female provider, right? Anything that the Employee Assistance Program can do to refer you to the best fit for you. But the only way they're going to know that is to be able to ask you some questions. And they will check in on you and ask how that's going. You know, did you have any luck? Do we need to continue our search for a different provider? And again, provider availability varies. So depending on where you are in the country, depending on, you know, how frequently you'd like to visit or what your preference is, or what specialty or expertise the provider needs to have, that availability can vary. So that's important to know as well.
And Jen, I just want to remind you, we're at 10 minutes till.
Yep. I'm about finished. And then I think, Robin, I'd love to hear the rest of the questions in case we don't cover any before I finish. So.
Okay.
All right. Yep.
Do you want to hear those now or?
No, I'll get finished and then maybe we'll answer whatever we've got time for.
Sounds great.
Thank you. All right. So I just wanted to give a snip of this would be what a sample EAP website might look like. And so you'll see, you know, sort of across the top, there's a variety of resources under wellness, relationships, work, and education. This can also be, by the way, if you have school-age children, some resources there. Financial, legal, lifestyle. I recently traveled to Europe, and there was some information in there that was really helpful for me, having been my first time traveling to Europe within lifestyle. There can also be some discounts in there, so it's always worth checking out. Home and auto, and then working abroad. You can see here, this is actually Ingenovis's. They have video spotlights, so using mindfulness meditation, unleashing the power of journaling, right? Resilience in stressful times. And then as well, these are all, there's a ton of resources. Over 35,000 resources sit within this one site. And that's even separate from calling the number or utilizing the live chat function. So this is something that you might see when you log into your employer's EAP. And I would encourage you to explore and look around. You can see the child care, elder care, college or university search, attorney search, right? A lot of resources sitting behind, you know, your employee assistance program. So I'm going to wrap up and I'm going to talk about some takeaways really quickly. My biggest takeaway is that ask about your employer's EAP. Understand what's available to you. Know that there is no stigma attached with needing resources. Use your EAP with confidence. Know that it is there truly to support you as an employee, to support members of your household. And really, we do such a great job. Well, I mean, not all the time, I'll be honest here, but we focus on our physical health, right? We tend to do a really good job of making our physical health appointments and, using our Apple Watches to count how many steps we got in. But man, what if we set an alarm for once a day or once a week or multiple times a day to check in on ourselves and what we need from a mental and emotional, standpoint as well. So that, I think, for caregivers who are out there, I have so much respect for caregivers because you are often the last person you think of taking care of. And so my ask to you is to walk away today with a plan to make self-care for you a habit, for you. I'm not going to follow up with anybody and ask what their plan was, but it should be something that works best for you to make sure you're taking care of you. All right. Last thing is, if you want to connect with me on LinkedIn, you can scan my QR code there. I'd love to be able to connect with people and hear any thoughts or stories or anything like that. And then if you have any other questions or thoughts or you want to reach out, you can email me at ACT@ingenovishealth.com, and I'd love to hear from you. I would invite anyone's feedback. So I appreciate your all's attendance and time today and just the care you put into being here with me. So thank you so much.
Jen, thank you. I don't know if I've seen so many reactions coming through the entire presentation. So hopefully you've been feeling the love because it's definitely been expressed, and thank you and kudos. You're seeing it now. And we do have a couple questions. I'll try to get to those. And if we don't get to all of the questions, you can always, yes, email us at act@ingenovishealth.com, and we'll be happy to get those questions to Jen and get back to you. So one of the first questions, well, actually it says not a question, but thank you for the information. And I thought that was awesome for someone to share. Another response was, this was fantastic. Thank you for this information. And then you do have a question. The question is, frustration and burnout can build up over time with just difficulty in communication, given the different ways we communicate across cultures or generationally. What are some tips on how to break down these gaps and simplify expressing when these challenges pop up? As a long one.
Yeah.
Let me know if I can repeat any of that for you.
Can you repeat the question? Well, yeah.
The question is, so they're definitely sharing how it can be frustration dealing with burnout, especially over time. They want to know how to address generational or cultural differences and gaps when they're expressing themselves and dealing with challenges. Yeah. And I think EAP is set up for that as well.
EAP is very, very good at that. Very good at that. I will tell you, frustration and burnout, EAPs are definitely equipped with that. I think, having the understanding that there is a difference in, cultural and generational, either communication styles or expectations or work styles, right? Just acknowledging that there are differences is actually a pretty, that's already pretty wise. I'm going to be honest with you. And that we may need to pivot. EAPs typically have entire sections dedicated to things we experience at work or in relationships. And so they can address differences in generational styles or cultural styles. Always feel free to email me like a follow-up question to that if there's something I could answer more specifically.
That was really good. And maybe if we could squeeze in one more. I think
Yeah,
you addressed this, I think you addressed this during your talk, but it says, will it go on my permanent employee file or record if I use
never.
EAP?
No one knows. I mean, the truth is, right? If you are utilizing, if your company utilizes an external EAP, and really and truly, if they have an internal EAP, there are HIPAA guidelines that would prevent, should prevent, right, and should protect you as an employee. Your employer can't make any notation that you've used an EAP or asked about an EAP. Um, if you're reaching out directly to the EAP, your employer doesn't know. They have no idea. If you're asking for EAP information, I can tell you after 16 years, never once have I thought, oh my gosh, this person needs EAP information. You know, what's going on? Yeah, in my head, I may have a place of care and genuine concern for the employee. But really it's, here's the information, right? Here's where you can find the information. Let me know if there was something you were looking for that is not here, or I would advise, recommend call that number. It's confidential, available 24/7.
Okay. And maybe one more, we have 3 minutes left. Learned a lot about EAP is more than just helping when I'm in trouble. Any tips on how can I break down stigma surrounding reaching out to EAP? Again, another question about stigma.
I love that.
Mhm.
I personally talk to anyone I know um, who is asking about. I had a friend the other day asking about elder care, trying to find elder care. And I said, did your company offer an employee assistance program? And her response was, I don't, why would I need that? I don't need like counseling. I need help finding elder care, right? Oh, your employee assistance program, should offer something along those lines. It's talking about it. It's being okay to talk to others about reaching out to an employee assistance program. It's okay to not be okay. And I think, that's part of, Robin, to your earlier point, suicide, prevention is that more people need to raise their hands and say, I needed help and I got help, and share their stories where they feel comfortable.
Okay. Thank you so much, Jen, for being with us. I knew we
You're
would
so
run out of
welcome. Thank
time. This
you.
is such a timely conversation to have. And just a reminder to attendees, if you were on with us today, you're automatically registered for a chance to win that virtual reality headset. And we hope that that will kickstart your journey into self-care and wellness. There's some really wonderful meditation and wellness programs that you can access through VRE headsets. Thank you so much. I think we're about at time for today.